Hello, I'm Michelle Convisor and I will be doing an abdominal assessment today. Today's date is January 11th, 2026. Here is a room scan and my patient. The ceiling scan, nothing. And then the floor scan, also nothing. Okay. That right there. Right there is good. Okay, hello. I will be your NP student today doing an abdominal assessment. Are you consenting to being recorded on video? This will be posted on YouTube as Unlisted for my professor to grade.
Yes.
Please verify your full name and date of birth.
Jeff Ezros, 125-1994.
And also, can you verify your sex by birth?
Male.
Thank you. I'm going to have you lay down for me in a supine position. That just means on your back. Hand hygiene is completed. Your knees will be slightly flexed, so I'm going to put this pillow under your legs here. Perfect. Okay. I'm going to begin by doing a visual inspection of your abdomen. I'm assessing for overall contour, symmetry, and surface characteristics. The abdomen to me appears flat and symmetric. I don't see any visible distension, scarring, lesions, masses, and I don't observe visible peristalsis. Okay. Now I will be checking the skin and sclera for jaundice. I'm going to start by looking at your skin. Your skin appears to be normal, no discoloration or yellowing. I'm looking at your sclera. Your eyes are white, and no discoloration there either. Now I'm going to move on to auscultation. This is done before percussion and palpation. And this is to avoid any altering vowel sounds. I'm going to start with the right lower quadrant. And I'm moving up to the right upper quadrant. Now to the left upper quadrant and left lower quadrant. All quadrants have normal vowel sounds. Now I'm going to go on to vascular sounds. I'm going to auscultate for vascular bruits. I'm going to start by listening over the abdominal aorta, followed by the renal arteries bilaterally. Now I'm going down to the iliac arteries and the femoral arteries. No bruits are heard. Now I'm going to do percussion over all the four quadrants. Are you okay if I touch you?
Yes.
Okay, thank you. I'm assessing for tympany versus dullness. And it is tympanic, which is to be expected. No abnormal areas of dullness was heard or felt. Now I'm going to be going on to the bladder. I'm percussing the suprapubic region, and this is to make sure that there's no bladder distension. And I do note tympany. And this means that there is no urinary retention. Moving over to the liver, the lower border. I'm identifying the inferior border of the liver by percussing upward along the mid-clavicular line. I do hear a change from tympany to dullness, which is consistent with the liver edge. Now I'm gonna move on to the liver scan. Using percussion, I will percuss the upper and lower border, and this measures within the normal adult range of 6 to 12 centimeters. Now I'm going to be moving on to the spleen and percussing here. I don't hear any dullness, which is normal. Now I'm moving on to palpation. Please let me know if you're in any discomfort. I'm going to be doing all 4 quadrants. So I'm assessing for tenderness, guarding, rigidity, or any superficial masses. The abdomen is soft and non-tender. No guarding or rigidity is noticed. Now I'm going to do the same thing with deep palpations. And I'm not noting any masses or areas of deep tenderness. Now I'm going to palpate your liver. Take a deep breath in for me. I don't palpate an enlarged or tender liver edge. Now I'm going to do the same thing but on your spleen. Take a deep breath for me. It's not palpable, which is normal. Now we're going to test for ascites. If I were to suspect ascites, I would then test for it using fluid wave test or a shifting dullness. But on my patient, there are no findings. Okay, now I'm going to be going on to the Murphy sign. This is to evaluate for any gallbladder inflammation. I need you to take a deep breath in, please. Do you have any pain?
No.
Okay, good. So there's a negative Murphy sign. Now, moving on to an appendicitis test. I'm assessing for any appendiceal irritation by palpating. And I am palpating the McBurney's point. I don't feel any tenderness though, which is a negative finding. Yay. Now, if you don't mind, please sitting up. I'm going to be testing for CVA tenderness. And this is the costal vertebral angle. And I'm checking this bilaterally. But no tenderness is noted on my patient. Now I am finished with my abdominal assessment. Thank you so much.